Dr. McAllister,
And,
we're ready when you are.
and we are live. Thank you very much. Hello, parents, kids, and my fellow doctors. Welcome to the August 2021 Walk with a Doc Kids Time from the Nevada chapter of the American Academy of Pediatrics, which we call the Nevada AAP for short. My name is Dr. Terrence McAllister, and I'm a pediatrician at Desert Valley Pediatrics in Las Vegas.
Dr. McAllister, we can't see you.
Is that better?
Yes, welcome.
Okay, sorry about that. I have a new phone. I'm still trying to work it out. So as I said, I'm Dr. Terrence McAllister. I'm a pediatrician with Desert Valley Pediatrics and also the treasurer secretary of the Nevada AAP. Now, we are doing our walks virtually and have been for the past year. We definitely miss getting back to our in-person walks at Springs Preserves or up at Mount Charleston during these hot, wet months. But for now, we don't think that it's safe for us to be doing these talks in person. Schools reopen in Nevada, at least here in Clark County, tomorrow. And I know a lot of the kids are excited to get back to in-person schooling. And we think it is vitally important for kids to get back to in-person schooling for so many reasons. And we are doing everything we can to support that, which is why we're doing these talks virtually. We would hate to have a talk and have kids potentially get exposed to COVID or spread it from one child to another or one school to another. And so until we feel that it's safer, we're going to continue to do these walks virtually so that kids can go to school in person, because that's the priority. You know, we do other things to keep schools open, like masks. You know, in my office and every doctor's office, we continue to wear masks. And now it's encouraged again for people in any indoor activity where they're encountering other people to wear masks. It's also strongly encouraged for children and adults in schools. Everybody older than the age of 2 should be wearing a mask at school, students, teachers, and staff. And again, this is just one extra layer of protection to keep those kids safe and to keep those schools open. So as I said, we're going to be doing this virtually again as we have for the past year. So our talk today, or our speaker today, is Dr. Lily Hidaji, and she is the co-owner of Oasis Pediatrics in Las Vegas, and she is also our coordinator for Walk with the Doc. And Dr. Hidaji today will be talking about vaccine preventable diseases. Now, as she's speaking, if you come up with questions, feel free to enter them in the chat box. And at the end of the talk, Dr. Hidaji will answer as many of those questions as she can. All right, Dr. Hidaji, whenever you're ready.
Thank you, Dr. McAllister, and good morning, everyone, and thank you for joining us today for this very important topic of vaccine preventable diseases. I really enjoy speaking to all my patients and families about prevention of disease and ways to keep ourselves and our children safe and healthy. As pediatricians and advocates for our patients, it's really important to educate our families and emphasize the importance of routine health maintenance practices. It is even more important now during this COVID-19 pandemic that we maintain the recommended vaccines for our kids, including the COVID-19 vaccination for children 12 and up. We're also closely following the new guidelines, as hopefully younger age groups will soon be included in the COVID vaccine administration groups. So let's first talk about a little bit about the history of vaccine preventable diseases. So we have vaccines that prevent against 14 different serious diseases, including whooping cough, hepatitis A, hepatitis B, pneumonia, meningitis, measles, chickenpox, diarrhea illness, tetanus, polio, and several other diseases. It's really wonderful that many of these diseases we don't see as much anymore because of these vaccines. So let's take, for example, the measles disease. Prior to the development of the measles vaccines in the 1960s, almost every child before age 15 suffered from the measles infection. 3 to 4 million people in the US were infected, and there were between 400 to 500 deaths per year from the disease. Measles infection can cause pneumonia. It can cause an inflammatory condition of the brain called encephalitis, and more seriously, it can cause death. With the advent of the booster dose in 1989, the effectiveness of the measles vaccine increased to 95% and has drastically reduced illness we saw prior to the vaccine. We completely eliminated measles from the United States in the year 2000 by effectively administering the vaccine and its booster to the population. However, in recent times, with misinformation and delayed vaccine rates, we're seeing the reemergence of diseases that are easily preventable with vaccines. In 2019, it marked the highest rate of measles infection in the prior 30 years, with over 1,200 cases when it was completely eradicated from this country. It's also important to note that these diseases are not only transmittable when in the presence of an infected person, but they can actually linger in the air where an infected person may have coughed or sneezed. And it can linger on objects that they may have touched, and it can stay on there for about up to 2 hours. So it's really crucial that we protect ourselves and our children by fully vaccinating them on time to avoid being exposed to these diseases that are present even when we may not be aware. So you may ask, who is most vulnerable to these diseases? Now, of course, we advocate that vaccinations are equally important for everyone, adults and children. Adults should be up to date on their vaccines, not only for their own health, but to protect their children and infants who are not yet of age to receive their vaccines or have not yet completed their full series of vaccinations. Infants and children with chronic diseases such as diabetes, asthma, heart conditions, and many other conditions may even be at more risk for secondary complications from these vaccine preventable diseases. So it is important not just for our health to maintain our vaccines, but to protect our kids, our extended families we interact with, our coworkers, as well as our communities. If an adult is unsure if their vaccine history or has no record of it, it is really advisable that you get up to date with your physician. You can call your physician's office or at the local pharmacy who carry the majority of recommended vaccines for adults. And to note, it is not harmful to receive a booster vaccine if it was received in the past, but no record is present. So I know when I ask a lot of my parents, they're unsure if they have a record of their vaccination schedule, they have new babies in the house. So I always recommend to them, if they're unsure, to go ahead and get a booster, which is not harmful at all. Parents may ask me often, is it okay and safe to get multiple vaccinations to be administered at one time? So regarding the history of vaccine development, it has really become much more advanced than when they were first developed. Initially, childhood vaccinations had about 3,000 antigens in them. And antigens refer to that component that is the immune boosting component of the vaccine. So it's either a protein or a sugar component of the virus or bacterial structure, and it activates our immune system to develop antibodies or immunity to the diseases. Now, the total of all childhood vaccines now contain about 150 antigens in total, which is a very minuscule amount compared to the thousands of antigens infants and children are exposed to on a daily basis just from playing outside. They put their hands in and touch everything, put their hands in their mouth, just from going to school or daycare, and just normal daily activities. So we also have combination vaccines to these diseases that were developed to reduce the number of injections to infants and children. And it is completely safe to receive multiple vaccines as scheduled, or to receive multiple vaccines if your kids are behind on immunizations. So what if the kids are late on their vaccines? Do they need to restart the series, which is a common question we may get. So if your kids are behind on their vaccinations, make a follow-up appointment with your pediatrician and get them back on track. Some of the preventable diseases, remember, require 3 to 5 doses of immunizations over several months. So it's important not to fall behind to avoid potential exposure to disease. It's important to know as well that if your child is behind on vaccines, that the series does not need to be restarted, but can be resumed where left off to complete the series. So let's talk about what's important currently in our communities, and that's the COVID-19 pandemic and the vaccination. So we can obviously see what can happen amidst a pandemic with a new virus, and when we're not protected with a vaccine and the devastation that it can cause. I know everyone knows a family member or friend who's been afflicted, or as physicians, we have multiple families that have been affected and have ended up in the hospital with secondary infections. So the rates of infections amongst children right now across the US is steadily increasing since last year. 22% of new COVID infections across the US are in children now, and which is probably an underestimation actually due to the lack of widespread testing and reporting. And it's important to know that children actually do carry the virus and can spread it just as adults can. And they can suffer secondary infections such as pneumonia. Last year, due to nationwide school closures, the transmission rates amongst children was much lower. However, that will likely increase as school attendance will be resuming this coming up week. Remember that symptoms from COVID infection can range from asymptomatic, which means having no symptoms at all, to mild symptoms such as a runny nose or a mild cough, or more serious symptoms that can be associated with persistent fever. There's a common misconception that if you do not have a fever or if you have mild symptoms that you may not be contagious, which is untrue. The virus can actually incubate, or meaning be present in your body, and you can carry it for up to 2 weeks before symptoms actually present. And they can be, like I said, they can be mild and just seem like minor cold symptoms, or parents or family may think they're just allergy symptoms, or cause gastrointestinal symptoms such as vomiting or diarrhea. So it's really important to be cognizant that symptoms may not always be cough and fever. Currently, unfortunately, only 44% of Clark County population is fully vaccinated against COVID-19, and 50% of those 12 years and older are vaccinated. So we are coming up on winter and flu season, and it's really crucial, especially this season, that we are protected and protect our kids against COVID-19, against the flu, and against all other vaccine preventable diseases that can emerge. Currently, the Pfizer brand COVID-19 vaccine is available for ages 12 and up and is easily accessible at various locations here in Las Vegas. You guys can text the word "get vax" or "vacuna" for our Spanish-speaking population, and you will receive 3 vaccine sites within a few seconds on your phone. So it's very easily accessible. You can also contact your pediatrician if needed, and they can help you as well with locations. The Southern Nevada Health District also offers services through Homebound at snhd.org for those who are homebound due to severe illness and can't leave the house. So what's our important takeaway from our talk today? So all of us have to do our best to keep ourselves, our kids, our communities safe from disease and diseases that are vaccine preventable. Families and adults, remember to get your boosters and receive all recommended vaccinations. Remember to schedule regular health maintenance examinations with your pediatrician to keep your kids up to date on their vaccines and healthy for the start of school and the cold season coming up. It is still recommended, just like Dr. McAllister noted, that we wear a mask, especially in the instances where social distancing cannot be maintained, and amongst kids under age 12, since they still, and above age 2, who still can't receive their COVID vaccinations yet. We have a responsibility to keep ourselves healthy so we can take care of our infants and children who may not yet be of age to receive their recommended vaccines against the flu, against the measles disease, and all other vaccine preventable diseases. We live in a populated society where we are all involved in constant close social interaction and travel both domestically and internationally. And a new pandemic of disease is only a plane ride away. So vaccines are safe, and they are the most important defense we have against these deadly diseases. Please contact your pediatrician if your child is due for a checkup and immunizations, or behind on vaccines, and get them up to date as soon as possible. Thank you everyone for listening, and I'm open to any questions. Dr. McAllister, are there any questions I can answer?
Yes, thank you for the talk. And we do have a few questions that have come in.
Sure.
The first question asks, if my child is feeling sick, if they have a cold, is it still safe for them to get their vaccines?
Yes, so we still recommend, and the American Academy of Pediatrics still recommends immunizations with mild symptoms. So if your child has a mild low-grade temperature, mild cold symptoms, it is completely safe to administer vaccinations. And if you're unsure, make an appointment with your pediatrician and they can reassure you as well.
Great, thank you. Another question about vaccines is a parent who's concerned about the cost of the vaccines and what should they do if they can't afford them?
Yes, so Southern Nevada has a great program. This is nationwide, but we have the Vaccines for Children program. It's a federally funded program that provides vaccines free of charge to families that are eligible, which includes uninsured families. who can afford insurance for their children. And these vaccines, we have them at our office. I'm sure Dr. McAllister offers it at his office. Call your pediatrician and they can verify whether they carry, if they're providers for the Vaccine for Children program. And if not, you can always contact the Southern Nevada Health District, and they can administer it at the health department as well.
And we also have a couple of questions that came in about COVID. The first question is it safe for my child to take swim lessons if they're not yet vaccinated?
Yes, so swimming is a wonderful activity for children, the American Academy of Pediatrics, and we all recommend still swim lessons for kids. So I think it would be important to call your swim lesson provider and instructor and make sure that ask them if their instructors are vaccinated, make sure that they wear masks. Little things that you can do is take your own towels so you're not sharing towels while you're there. Ask the instructor what the size of the, of the class is. So a smaller class would be better so that they can maintain distance in the pool. And, just taking those precautions will keep you guys safe and the kids safe too.
Okay, great. And then there was one question that came in about masks. As a parent who's concerned with putting masks on such young children, is there any risk to their lung development by wearing masks so frequently?
No, not at all. So there's no risk to lung development or trapping carbon dioxide or decreasing oxygenation or receiving oxygen while you wear masks. For kids 2 and up, it's recommended everyone 2 and up wear a mask. And these are breathable masks. So typical disposable medical masks and cloth masks are breathable. So they do not trap carbon dioxide. They do not cause abnormal lung development. You can very easily breathe and receive normal oxygenation through regular masks. In fact, not wearing a mask could potentially cause lung damage by increasing exposure and potential secondary infection and disease from various infections.
All right, great. Thank you very much. Well, that was all the questions that we have, and thank you for all that important information.
Thank you.
Now the talk part of our Walk with the Doc is done. So we're going to do the walk. And as we've been doing for the past year, we'll do it at our own homes. So we're going to shut off the live feed and go out for a walk. I will go with my family. We'll take pictures as we're out walking and post them to our Twitter feed at Nevada AAP. And we encourage everybody else to do the same. Try to walk for at least 30 minutes. Bring lots of water. It's very hot outside, and make sure you're wearing sunscreen. And then just enjoy the beautiful day, the last day before school starts. And good luck at school tomorrow for everybody who's restarting. We will have our next walk next month, the second Sunday in September. Whether it's live or virtual, still a little bit up in the air right now. But as I said, as long as it's the safest thing to do is for us to do them virtually, we'll continue doing that, and we'll go back to live walks when it's safe to do so. Thank you, everybody, for joining us. Have a great walk.
Thank you.
Hi, everyone. I'm Leanne McAllister. I'm the Executive Director of the Nevada chapter of the AAP. The Twitter feed is at AAP Nevada. I know that can be tricky. Dr. McAllister said it the other way around, but you'll also find a link from our homepage. And for our Spanish-speaking families, next Sunday, August 15th, we have Camine con un doctor, and where our featured speaker will be talking about adolescent anxiety. And you can learn more about that on our website, nevadaaap.org. Thanks, everyone.